cholesterol is a very misunderstood substance. We can say it's actually a type of fat. It's like a fat-like substance, okay, and it's very necessary for the body. It is actually a good thing for the body. It's just that when it goes higher and higher, and then we kind of correlate it with heart disease and stroke, and that is what increases the tension around cholesterol. So when you say good cholesterol, bad cholesterol, so basically you break down cholesterol into HDL, that is the good cholesterol, okay, high density lipoprotein, and bad cholesterol is LDL, that is low density lipoprotein. All right, but there's something else also. There's, when you talk about a lipid profile, okay, it's not only cholesterol that you're looking at. It's actually something called as triglycerides, which I call as the bigger brother of cholesterol, because triglycerides can actually thicken the blood. So with the scare of COVID and everything, triglycerides actually gained a lot of popularity also. Okay, so when we talk about cholesterol, we should always talk about lipids with cholesterol, good, bad. There is something called as VLDL also, okay, very low density lipoprotein, which is also a bad cholesterol. And then on the other side, you have your triglycerides. See, that, like I said, when we talk about cholesterol, the numbers also keep changing. The reports also have changed, in the last 5 to 10 years, and there are multiple reasons for that. But predominantly, when your bad cholesterol is constantly going up, okay, normally we say we like to keep it, between 100, maximum 120 is acceptable from an LDL, bad cholesterol perspective. But if you have any comorbid condition like diabetes you have, or you have blood pressure, then the aim is to keep your bad cholesterol at 100 or below 100. Okay. Then when you talk about your good cholesterol, your aim should be to keep it at least above 45. The good part will be above 50. If your good cholesterol is below 45, mostly it could be because of genetic history or family history, or because you're very, very inactive. Okay. Now, when we talk about total cholesterol, it's a combination of everything, but you need to talk about the ratio of good and bad cholesterol. So if you can increase your good cholesterol and you can reduce your bad cholesterol, then the ratio will protect you. Why? Because your LDL is known to increase the plaques, something called as atherosclerosis. Now, what is atherosclerosis? These are these LDL which kind of can mix with calcium and other substances which make plaques within the arteries. So when you have a lumen, then you have plaque formation around it, which obviously will reduce the size of the lumen because of the plaque formation. Okay, so when your blood is flowing through this, if your lumen is becoming smaller, obviously the receiving end is not getting oxygen, nutrients, nothing, right? Because the blood is getting cut off. So this can become a problem area if your vessels of the heart are affected or vessels of the brain are affected, because then you can go into heart disease or you can go into stroke. Okay, but sometimes what happens is that the plaque is still there, but this plaque can get dislodged. What does that mean is the plaque which is there, it breaks away. It breaks away and it goes and sits somewhere else, or it can again go into a heart artery. It can even go into the brain artery, which is known as a heart disease or a stroke. Okay, so why it breaks? Normally we say it is due to something called as inflammation. I know inflammation now has become a fad. Everything is inflammation. Okay, but these are one of the important things why you need to keep cholesterol lower, so that you don't, even the amount of plaque that is formed is also on the lower side. Okay, so that tomorrow we don't know where inflammation, of course we know things like refined oils and all can increase inflammation in the body. Okay, so we still need to be careful about inflammation, so that clot doesn't get dislodged and go and sit somewhere else. So biggest issue with uncontrolled cholesterol. Now when I say uncontrolled cholesterol, I have patients who refuse any treatment even when their LDL, good cholesterol, is 200. And what did I say? The cholesterol had to be 100, the bad cholesterol. So it is when your bad cholesterol is 200, isn't that a very risky factor for you? Imagine how much of cholesterol, how much of plaque formation you're doing every day. So whether it is medication, whether it is lifestyle, it needs to be treated. Otherwise, you will increase your chances of heart disease or stroke. And if you have family history of diabetes, fatty liver, blood pressure, heart disease, stroke, then you have to be extra careful. Things like thyroid and diabetes do have symptoms, but higher cholesterol can go without a symptom for the longest time. We worry more from a complication perspective. Now, the first part you said, how much is too much? So the guidelines are very clear. I know the numbers have changed, but your LDL should be between 100, maximum 120. If you have no comorbid conditions, no family history, nothing. Okay. Then you have HDL, which we prefer to keep between 45 and 50. Very good above 50. Work a little harder below 45. So, like I said, suppose you have a patient who comes and says, my HDL is below 40, my LDL is above 150, 170. Then obviously that is too much, right? And then on the other side, we said, don't forget the bigger brother. I'm not looking at total cholesterol. I'm looking at the ratio between good and bad. But the other side, you have something called as triglycerides. So normally we say triglycerides, we need to keep it under 150, 150. So if you say that your triglyceride is rising, one report said 170, next report has come back 200, 220, 250, then obviously that is too much. How you want to treat it, that's a second problem. But right now, at least you have been diagnosed with it's called a hyperlipidemia or a dyslipidemia. There are medicines to treat cholesterol and medicines to treat triglyceride also. The commonest medicine that we can discuss today is something called as a statin. And unfortunately, again, statins are quite misunderstood also. Okay. Yes, statins can have some side effects for some people, not everybody. Okay. Some people taking a higher dose of a statin for 10, 15, 20 years can get pushed into diabetes if you're not taking care of yourself. Okay. But if the numbers we discussed before, and your cholesterol is constantly rising, your family history is there, then taking a statin prescribed by your doctor will become necessary. Okay. Now, when you say what are the other side effects, you say sometimes if you start a statin, you can have some amount of body pain and muscle pain. It's called myalgia. Okay. Again, if you are stretching, if you are eating selenium rich foods, CoQ10 rich foods, you don't have to suffer from any of these side effects. Okay. Because the advantages of the statin are actually much more. Now, what are the advantages? One is obviously it reduces your bad cholesterol. Okay. It can increase your good cholesterol. It can reduce your triglycerides also. Okay. Second most important advantage is that it keeps your arteries a little flexible. So it is a known fact that as we are growing older, okay, our arteries, which are supposed to be flexible and, they allow expansion when you're exercising, there's more expansion. So more blood comes through. As we grow older, they become a little rigid, like iron rods, rigidity increases even in the arteries. So that expansion doesn't happen. Statin helps you keep the arteries a little bit more flexible. Not too much, but a little bit more flexible. Third advantage is what we spoke about initially was the plaque formation. Now, one is a plaque formation, but second, what we worry about is that plaque getting dislodged and flowing through the blood and going and sitting somewhere else. Correct? So cholesterol actually makes the plaque a little rigid in the sense it doesn't let it break away. So the statin is important for these three reasons. One is direct reduction in the lipids. Second is the increase in the flexibility of your arteries. And third is it makes it a little harder for your plaques to break away from the artery. So the chances of it going and sitting somewhere else, getting a stroke and all actually reduces. Now, of course, no one is saying that high cholesterol or statin will completely assure that you'll never get a stroke or will never get a heart attack. It's not true. Nothing can assure you that, but it does help the chances or reduce the risk of getting heart disease or a stroke. Now, if you ask me, is just a medicine enough for treating cholesterol? My answer is no. The medicine might be one aspect or part of it, but if you really want to free yourself from lipid issues, cholesterol issues, triglyceride issues, BP, blood pressure issues, diabetes issues, you really need to open your mind to lifestyle. Lifestyle is nothing what you do every day. The habits that you do every day is lifestyle. So your exercising, your food that you eat, sleep, stress, these are the things which need to combine. You need to combine with the medicine to treat any form of cholesterol issues. Let's say anybody over the age of 30, at least once in a year or once in 2 years is minimum. You should do it. Okay. As we start to grow older, probably 40, 45, 50, once in a year, compulsory. And this I'm talking about the people who have come back with a normal report. There is no cholesterol issue. Triglycerides are normal. Very good. No problem. Okay. But a general comprehensive check once a year, once in 2 years should be done. Suppose you have very strong family history of heart disease. What does that mean? Your dad has it, or your mom has it, or your grandparents have it, someone has it, or all your uncles have it. Then probably testing even below the age of 30, probably 25 up, 22 up, is a good idea to get it checked at least once. Okay. If it's normal, don't worry about it. If it's on the rise, then really take control of your lifestyle. Don't, not medication, but take control of your lifestyle. If it started rising, not very high, then we say that I know I have cholesterol. I have found it out. Okay. Now I want to do something about it. So I'll say I don't want to go on medication right away. I'm young. I want to make lifestyle changes. So whatever lifestyle changes you're making, you have to retest the cholesterol in 2, maximum 3 months to find out whether the cholesterol is coming down or not. Okay. Fact remains, cholesterol takes longer to come down. Triglycerides can come down very fast, go up very fast also. Okay, so both the things, so it's something called as a lipid profile. You have to do a lipid profile. Lipid profile has to be done on an empty stomach, not after eating anything, because triglycerides need a fasting state. Okay, but anybody who's making active changes, anybody who has started on medication, 2 to 3 months you have to do. Suppose you have managed to reduce your cholesterol now. You're doing well, you're managing yourself, you know your medicine is there or not there, but lifestyle is getting maintained. Check again in 6 months. Check again in 6 months to make sure that you're on the right track. If you are on the right track, then you can check after a year, no problem. Again, we talk about prevention of cholesterol. If you can't prevent it, you have to postpone it. If you can't postpone it, it has come. Please manage it. You can reverse it. Again, we will not use the word cure again, but prevention, postponement, controlling it, management is all in your hands. Okay. Now, this, whatever I talk about lifestyle, is your baseline. On top of that, if you need medication, that's a different thing. But everybody with or without cholesterol must be doing simple things like, again, back to square one, exercise. Do it at least. See, continuity. I think consistency is what is important in lifestyle, because what happens is that we do it for 3 months, we do it for 6 months, and then Diwali comes, or someone falls ill, I fall ill, we fall ill, or COVID happens, and then everything goes out of the way. So make a lifestyle which you're able to do irrespective of what is happening around you. Okay. So keep it flexible. So learn to exercise. I think what is most important is learn to exercise. Okay. Walking can be done anywhere in the world, but people come back and say, I get bored to walk. Okay. If you get bored to walk, then something like a dance or a Zumba, or combined with a little bit of, functional training where you have squats and lunges, or you have your yoga, which can be done anywhere in the world. Okay. There is something called as Pilates, which does require some equipment also. But if you like it, I have no problem. Think about weight training also. Okay. A little bit of muscular development is actually quite good. So if you tell me, what is an ideal combination, you would say about, let's say 30 minutes of walking, and you can do a 30-minute yoga or a 30-minute of weight training. Why not? Or you can say 45 minutes of weight training thrice a week, and 45 minutes of walk thrice a week. So that's about 6 days a week. Excellent combination. Okay. So exercise is important. So reduce your sitting, reduce your belly fat. If your belly fat is going down, automatically you know that the liver is feeling better also. One more very important thing when it comes to cholesterol and sitting. Sitting is the new smoking. That is a fact. And why that is so important? Because sitting and smoking both will reduce your good cholesterol. What we said, HDL, good cholesterol, is protective. It protects your heart. It protects you from the bad LDL. So if you sit all day long, then your chances of HDL increasing will not happen. In fact, your HDL will start coming down. Okay. In the same breath, I'm saying smoking. If you are still smoking, you are wasting your health. You're absolutely blowing your health away in smoke. Your money is getting wasted. Your cholesterol will not get better. Your HDL will not get better. So for anything you want to increase your good cholesterol, think about these aspects. Okay. Then you talk about food. Predominantly, you should think about omega-3 rich foods. Very important to talk about omega-3. You talk about fish, salmon, if you're a vegetarian, flax seeds, walnuts. It's the dietary aspects for cholesterol. Okay. One of the most important aspects is omega-3. Okay, when you're talking about omega-3 from a non-veg perspective, fish, salmon is quite rich in omega-3. But from a vegetarian perspective, you have your flax seeds or your walnuts, which do impact. Chia seeds are also there, which do give you some amount of omega-3. Okay. Of course, if you do have a higher cholesterol, you can talk about omega-3 supplementation from your doctor or from your health expert. Please do not self-supplement at all. Why is omega-3 so important? Because omega-3 helps you to increase your HDL, that's your good cholesterol, decrease your triglyceride, and as a third aspect, can help to decrease the LDL a little bit. Okay. So be very careful about omega-3. Then you talk about fiber. When you talk about cholesterol, you should say the word fiber 100 times in the day if you have to, because vegetables, not fruits, but vegetables are extremely important to leach out cholesterol and throw it out of the body. Okay. So you talk about salads, you have, carrots, kakdi, tomato, cucumber, tomatoes, any form of salad is good. Okay. Radish is very good. Okay. Then you talk about saute vegetables, and you talk about cooked vegetables. Okay. So there is no rule that you only have to do salads, but yes, raw foods, raw vegetable juices also have an impact. Saute vegetable, cooked vegetable also have an impact. Okay. Then you talk about garlic. Now, garlic is again something which is good for reducing cholesterol. Okay. Now, when you talk about garlic, I'm not saying keep popping 3, 4, 5 garlics. Okay. If you can't, garlic can increase. Sometimes it can cause burps and cause acidity. Sometimes, especially if you're taking it early in the morning. So it's okay if you don't have it early in the morning, but you can add a little bit more garlic in your food or your vegetable juice. Crush the garlic and put it inside and have it as a with the vegetable juice. That's not bad at all. Okay. So omega-3, fiber, garlic. Then you talk about oil. Okay. Oil, ghee. It's not, of course, you try to keep yourself away from refined oils. Okay. Look at unrefined oils. Look at cold pressed oils. Okay. Olive oil is heart friendly, but don't try to use olive oil for Indian cooking and tadkas, even if the bottle says for Indian cooking. Don't do that. Okay. And you can look at unrefined, coconut oil. You can use. Be careful. So what I normally coconut oil is a gray area for cholesterol because it is saturated fat. So sometimes it can increase the LDL, but most of the times it can reduce the LDL. So if you're trying something for yourself, check your numbers before and after also, because that's the best way to understand. Okay. But otherwise, you have all the other types of oil. You have sesame oil, you have mustard oil. Quality is one thing, but the quantity, like even we know ghee is very good, but of course it's saturated fat also. So quantity is very important. So when you say quantity, how much is the quantity? So half a liter per person per month is your quantity that you have to look at. So suppose you say, obviously you can't calculate for yourself, right? You have to look at your house ka oil, ghee, butter intake. Okay. So suppose you say Akshat has 6 people living in his family. Okay. You need to cut it below 3 liters. Okay. 3 maximum okay, 3.5 liters. You should not be above 3.5 liters. So you could be having the most expensive cold pressed oil, most expensive. But if for 6 people you are going to 4 liters, 5 liters, 6 liters, you're still creating problems for yourself. Okay. So quantity is extremely important when you're talking about cholesterol. All right. So these are the 4, dietary aspects which you need to be very careful about. Of course, don't overeat and keep your gut clean is all very important from all these aspects. All right. Then again comes down to sleep. You want your liver to relax, you want to repair yourself, you want to heal yourself. Please concentrate on 6 to 8 hours of sleep very, very sincerely. Okay. Quality of sleep, yes, is important. Okay. You want to use an alarm to get up, that's okay. But if you're going to be sleeping at 3 a.m., 4 a.m. with no reason, okay, you are a night shift worker, you have work in the night, that's a different thing. But you're scrolling on the phone, you're, just binge watching something, or you're eating something, or you're just sitting and partying, and you're ruining your sleep cycle. It's not really worth it. It's really not worth it. Okay, so be very careful of your sleep. Last but not the least, talk about stress. So whatever we discussed, how do you understand what you have to do is you have to manage your stress. Okay. We all know things like control, perfection, with something called as type A personality, increase the chances of heart disease. Okay. You're too hyper, you're controlling everything. You want exactly the things you want your way. You're very angry, you just shout at the drop of a hat. You might become okay the next minute also. But that impact is irritating for the heart. Okay. So Please be careful of what stresses you out. Think about meditation. Okay. Just 10 minutes of meditation, or if you don't believe in meditation, a little bit of prayer. Of course, they are very different, but whatever you believe in, there's prayer, there's chanting, there's positive affirmations, there's visualization. Okay. And on top of everything, breathe. Okay. You want to battle cholesterol, you want to battle heart disease, you want to battle blood pressure issues, you have to have good control over your breath. As our stress increases, we become very shallow breathers. Dogs are very shallow breathers. Humans are supposed to be deep breathers. But because of our fast paced lifestyle, we don't even have time to breathe. So we have to start retraining the mind to actually become deep breathers. So very simply put, start your day with 5 deep breaths, end your day with 5 deep breaths. You're sitting to eat, you're sitting in a bus, you're in a train, you're traveling. Breathe. Just try to breathe a little bit. Okay. Next time you are stressed, okay, you want to throw like a reaction where you want to shout or yell, stop yourself a little bit and breathe. Just 3 deep breaths, 5 deep breaths, and see how your reaction changes. So if these aspects can come together, then you're not only protecting your cholesterol, but you're actually directly protecting your heart. So if these things can be done over and over and over again consistently, that is when you're actually, training yourself to prevent heart disease, postpone heart disease, prevent cholesterol, prevent postpone blood pressure, everything.